Happy Friday, everyone, and welcome to Physio Move and Groove. My name is Jeannie, and I'm a physical therapist with over 25 years of experience helping people to feel well, move well, and be well. So today, I am super excited. We are going to be talking about one of the things that I see people for the most often. What do you think it is? Take a guess. It's low back pain. I want to say the majority of people at some point in your life, if you haven't experienced it yet, you're going to experience some sort of low back pain. Now, what do you think is the number one cause of low back pain? Any guesses? Well, it's this. It is poor postural stresses. That is the number one cause by far of low back pain, especially more prominent with all the sitting that we do. I think especially since even people after COVID have not gone back to going into offices, they're sitting a lot more. And all this sitting stress, what it does is it puts a lot of stress on the ligaments around your low back, causes them to be overstretched, and that's what gives you your pain. So if you take a look at your back, there should be natural curves that you have in your back. So something called a lumbar lordosis. It's this natural kind of inward curve that you should have in your low back. That's normal. But when we slouch or we stand with poor posture, we lose that natural born curve. And that natural born curve has been shown to cause mechanical low back pain, and in fact, chronic low back pain. And oftentimes when you first start to have back pain, you'll notice it after you're sitting for a while, you'll get up, you'll feel a little stiff, you'll start walking, you feel better. So what do? We ignore it because it's just like this moment of pain, and it only happens when we sit for a little bit. But then as time progresses, well, now we start to have pain a little bit even when we first get up and start walking. It's still there for a bit. But you know what? It's still okay because it's not there all the time. So what do? We ignore it because we're just too busy to address it. But in time, that back pain will continue to progress, and we'll get to the point that you're going to be bent over and not even be able to straighten up and start walking. So it's much easier to treat low back pain if we can get it right from the start. So the very first reason, as I said, is poor posture. So you got to work on that in sitting. So I'm going to grab my chair and show you a couple tricks that you can use for sitting to have good posture. Now, first of all, in any kind of chair, you want your back to be at the very back of the chair. Now, if you're vertically challenged like I am, if I sit at the very back of my chair, my feet are no longer on the floor. So you need to be able to have a little stool so your feet can actually be on the floor. Now, it would be great to say that you'd be able to keep this perfect upright posture all on your own. And you probably can in the very beginning. So when you think about it, what I want you to do to try to find the perfect back position is to really go into a lordotic position, like hyperlordotic, and then go into a super flexed position, go back into that hyperlordotic position, come off just 10 degrees, and that is perfect posture. Now, looks pretty easy, but I will tell you within about 5 minutes of sitting like this, you are going to revert to this kind of activity. And a lot of times, the worst position for your back is to sit on the edge of your chair with your feet crisscrossed behind you on your computer, which is probably the way that most of us tend to sit. Or sometimes another option, we may actually sit with one leg crossed over the other. Horrible position as well. Then you torque your pelvis and you get stuff shortened on one side, lengthened on others. You got to get a whole bunch of muscle imbalances from that. So your feet should always be down flat on the floor. If not, then again on a little bench. Then you're going to use what is called a lumbar roll. They sell lumbar rolls, but if you don't have a lumbar roll, you can take a beach towel, tape either side to keep it nice and tightly wound, and you're going to put this in your low back. So basically what you're doing is creating a constant lumbar roll that keeps you upright and in the position you need to be in when you're sitting. So no matter where you're sitting, whether you're sitting at your desk, sitting in your car, you need to have this upright lumbar lordotic position, and the lumbar roll will help you maintain that position without getting tired. You'll be able to just keep it there. Now, having said that, anytime that you are working, you really shouldn't sit for longer than about 20 to 30 minutes. So you need to be able to get up out of your seat, walk around a little bit, do some back bends, and then sit back down every 20 to 30 minutes. Maybe every time you look at your watch or you look at your phone, you can think, okay, posture check, and then get up and walk around a little bit. The other thing to think about that you can do if you're not able to get up as often as you'd like is you can do a couple things while you're sitting. So you can do a deep lordotic bend into a flexion bend, and you'll just simply go back and forth into that lordosis and then forward bend, and you'll do this 10 times. And you can do it 2 to 3 times throughout your day. It just gets that whole back moving instead of staying in that stationary position. Our bodies love to move and they hate to stay stable and stationary. So we got to keep moving. So 10 times throughout your day, 2 to 3 times a day, you can do that particular exercise just to get your blood flowing in those back muscles. Now, if you've got this back posture down pat, you're doing great with it, but then you go home and you iron, or you go and you pick up something and you stoop forward and you lose that lordosis with all your day-to-day activities, well, now you've just reversed everything you did all day with your good sitting posture. So you must make sure that when you get home that you also maintain the good lordotic posture. I do have another video for you, luckily, that talks about how I can do my household chores and maintain good back posture. So you might want to check that out, because laundry is probably one of the worst things for people to do to maintain good back posture. There's one simple trick you can learn to do to not hurt your back. Now, let's say you've done all this. Let's get rid of our chair for now and our little stool. So you've tried all this now for a couple weeks, thinking it's just purely posture related, and it's just not getting better. So where do we go from there? We move on to the Robin McKenzie method. Robin McKenzie was an Australian physical therapist, might have been New Zealand, who actually was the forerunner of a program that works really well to decrease low back pain. You're not going to believe it. I have seen magical changes with this program. You literally can get rid of acute low back pain that people have had, excruciatingly 10 out of 10 back pain that they've had in 3 days. So are you ready to learn what to do when this happens? I bet you are. It's unbelievable, but I'm telling you, it happens all the time. So first exercise is actually going to get yourself to lie on your stomach. Now, I'm going to preface this with saying you really should see your healthcare practitioner before you start this program. Other things to keep in mind when you do this program is we want the pain to centralize. That means we want the pain to come out of your leg and go up into the middle of your spine. So if the pain starts to centralize and go upwards, that means you're doing the right thing. Sometimes when you first start doing the exercises, you might get a little bit of increased back pain. That's normal. I want you to keep working through it. The only time that I'm going to have you stop these exercises is if the pain starts radiating down the leg or it gets more and more intense with every time you do a repetition. So the very first exercise you're going to do is to lie on your stomach, on your bed, head turned one way, arms down, and you just simply want to relax. So you just want to try to be able to completely relax. Let all the muscles in your low back relax. You're going to take a few deep breaths, maybe 4 to 5 deep breaths, just to really let everything calm down. This is getting your body ready to be able to do the next 2 exercises. Now, once you've chilled out here for 2 to 3 minutes, then you're going to come up on your forearms. And you want to do the same thing. When you're coming up on your forearms, you want to make sure that you relax your low back. Do not hold your low back tense. Do not raise up on your hips. Take 3 to 4 very large, deep breaths and just let all the muscles in your low back relax. Now, as I said, you may have slight increased low back pain when you do this initially because you are reversing the direction that you injured your back. If you start to have leg pain that radiates further down your leg as you're doing this, then I don't want you to do that particular exercise. This is all in preparation for Mackenzie's #1 exercise that will be the biggest change for you, and that is the prone back extension. So that next one, you're going to put your hands underneath your shoulders and you're going to come all the way up. Now, at first, if you can only go up a little bit, that's okay. Go up a little bit and then you can come back down. Now you're going to go up. You're going to hold it for 2 to 3 seconds when you come up. You go to the point just before you start to have pain. Relax that low back completely. Keep your hips down and then come back down. Now the intention is we really want to try to get full arm extension. So you want to be able to lock those elbows, relax those hips, and let your low back sag. And take a big deep breath and let your low back sag even more to get that extension and that lumbar lordosis. You'll hold it for 2 to 3 seconds and then you're going to come back down. Now again, as I said, the first few times you do it, your back might be a little bit stiff. You might not be able to get that locked arm position. So you only go up to the point that you can go, but you go as far as you can go. And the more repetitions you do, you should be able to get further and further to get that lumbar extension. So again, folks, you're going to push all the way up, lock your elbows, take a deep breath in, breathe out, let the low back sag, and then you'll come back down. So what Robin Mackenzie will tell you to do is to make sure that you do 10 repetitions of those press-ups every other hour that you are awake, which is about 6 to 8 times a day. You're going to start on your stomach first, a couple minutes just to get the muscles to relax. You'll go up on your forearms, and then you'll do the press-ups. Now, I understand sometimes if you're at work and you're in an office, you might not be able to do the press-up. So the next best thing you can do is a stand-up back bend. So you're going to stand up like this. And again, a lot of people, when they try to do back bends, they push their hips forward and bend their knees. I'm not really doing much from my back there. So you've got to make sure you're not pushing your hips forward, that your hips stay where they are. You're not bending your knees, and you're just going to simply bend your back backwards and move your head back as well. And then you'll come back with it. And then you'll do the same thing again. So you're doing your back bends in standing. Now, the reason why it's not quite as effective is because you can't get as much of that lordosis from doing a standing back bend as what you can from a prone press up. So if you really want to get this program to work, you need to do your prone press ups. So 10 times every other hour that you are awake, do the prone press ups, do the sitting with the proper back posture, do your ADLs, again, all your activities of daily living with proper posture, and this should really help you to be able to decrease your low back pain. Now, some of you may be asking, okay, well, when do I get to be able to add bending forward again? Because I don't want to just all my life bend backwards and not be able to bend forward. And you might be saying, well, after 2 weeks of doing this, now I don't have any low back pain. So when can I start adding on my other exercises? Or you may be saying, this isn't working. I've tried this for 4 days. This is supposed to work after 2. I've tried it for 4, and it's not getting rid of my leg pain at all. Well, sorry, folks, but you're going to have to tune in next week as we do part 2 of the Mackenzie method, so you can learn the answers to all of these questions about how to progress the method. But I figure this is a great place for you to start if you have that acute low back pain that's really bothering you. And it is most effective if you can start to incorporate these programs within the first couple days of you experiencing low back pain. So, as always, folks, I want to thank you so much for tuning in to Physio Move and Groove. I really hope that you will subscribe so that you can learn all the interesting facts that I like to give you every Friday, that you can like it, that you can comment, and that, of course, that you'll tune in next week so you can figure out the answers to those burning questions that we asked tonight before we're leaving. So have a wonderful weekend, and I'll check you all next Friday.